Music, a universal language that transcends generations and cultures. A classical drum like this has power and grace. It is the heartbeat and the music of so many communities through time. Music ignites passion and builds bridges. Hi, everyone. Hey, good morning. Thank you for joining us here today at CHI Innovate 2023. This is a conference for you to build bridges between the health and social care industries. So first, I want to say hi. My name is Kim. I want to introduce you to our guys from the Big Boys Club. Yes, I love the name also. Hello. Okay, so... That's right. We have more members who are coming up very, very soon. But first, I want to introduce you to a little activity, okay? We're going to start the conference off with a little bit of fun. So you're going to join us in trying to build a bridge throughout the entire day, okay? So this is the first thing I need you to do. We're going to show you a little demonstration. So everyone just help me out, okay? Just do a chest and a clap, okay? Chest and clap. Chest and clap. Chest and clap. Chest and clap. Okay, so second part of this, very easy. It's a chest, tap, tap. Okay? Chest, lap, lap. Chest, lap, lap. Chest, lap, lap. Chest, lap, lap. Okay, so now, combine. That's right, we're going to combine the two. So we do it first for you. It will be chest, clap, chest, lap, lap. Chest, clap, chest, lap, lap. Chest, clap. Chest, lap, lap, chest, clap, chest. Exactly. Okay, very, very good. We're going to try with a slow drum beat. Okay, we do it slow first. All right? Okay? Chest, clap, chest, lap, lap, chest, clap, chest, lap, lap, chest, clap, chest, lap, lap, chest, clap, chest. How about faster? Chest, clap, chest, lap, lap, chest, clap, chest, lap, lap, chest, clap, chest, lap, lap, chest, clap, chest, lap, lap. Okay, that's great. So, you guys are going to do this, all right? And we're going to hear a very special song. I think you'll recognize it the second it plays. You guys ready? All right. Yep. Keep going. Very good. Applause for yourselves. That was really, really good. Thank you so much for building this first bridge along with us. All right, we're going to be building bridges throughout the conference. So please enjoy your day here. We'll be back later on. And of course, enjoy the rest of the conference. Thank you.
Thank you. Thank you so much, Big Boys Club. Wow, that has woken me up. And I didn't even clap as much as the rest of you. You looked fantastic. Good morning, everyone. Oh, I wasn't expecting you to all answer. Thank you. We try it once more, just to check you're really awake. Good morning. Oh, beautiful. Okay, that was Big Boys Club. You're going to hear more from them later. And my name is Tamsin Groylich-Smith. I'm the Director of School of X at Design Singapore Council. Now, this beautiful man on the screen behind me is currently delayed. He left me with a pile of scripts to read, so he definitely owes me a drink later. He will be joining us very soon, but in the meantime, I apologize you're stuck just with me, and I'm here to get this wonderful event started. We're delighted to welcome you to CHI Innovate 2023. And you know, I remember doing the 2020 version. You remember 2020, everyone, yeah? It was a very different version, and it's absolutely incredible to see you all here today. This year, for the first time ever, we're completely sold out. So thank you. Thank you so much. I've had people messaging me all week saying, can you get me a ticket? Can you sneak me in? So I think somehow we have a great value proposition here. And I think the topic today is more interesting than ever. And believe it or not, this is our 7th run. So, wow, amazing. I would like to, having waffled on for so much, I would like to officially welcome all of our special guests here today. We have Professor Eugene Fidelis-So here, CEO of Tan Tock Seng Hospital and chairman of the CHI Co-Learning Network. We have Dr. Chong Wei Yang, who I've lost there, who is the DS of Technology from MOH. Welcome. I would like to welcome all of the board members from National Healthcare Group, leadership from all 8 healthcare clusters, all 3, my eyes are going now, and not enough coffee, so Hontim and I must be both in the same camp. Our CHI partners, council members, and fellows and friends, and to all of you, welcome. We do have a full house today, so if you're going to leave, maybe give your ticket to someone else, yeah, because there's people queuing up waiting to come in. We're also joined by a record number of 23 exhibitors this year. You can see them down on level 2. You can see their logos here, and there are a lot of really interesting booths down there. We hope that you'll enjoy visiting them during the breaks and lunchtime, although first break is quite a short one, so maybe not then. We'd like to give special thanks to NEC Asia Pacific, our silver sponsor, to the National Health Innovation Centre, who've organised, as I mentioned earlier, the morning break, and the thing I'm super excited about, the ice cream later today. If you ever want to know how to win my heart, ice cream is there. I'd also like to thank community and social sector supporter, Singapore Pools, and our lunch panel host, Intellect. Okay, so now it's about you, the audience. We have an unusual crowd this year. Not really unusual, one that should have been a long time coming, but it's a more mixed crowd than usual. Fewer people from healthcare and more people from the social care sector. So maybe we can have a little show of hands. How many of you would define yourselves as being from the healthcare sector? Maybe wave your hand over your head. Oh, hello, everyone. I feel really popular now. Okay, how about social service sector or social care sector? Oh, wow. Okay. Hello, friends. And I consider myself extremely lucky that I've spent many years working with a foot in both camps. So I see familiar faces on both sides. Thank you. This really is about trying to look at how we build bridges between the two sectors. Bear with me. And as you can see, this is the theme of this year's event, building bridges between health and social care. We know that medical care only contributes to 20% of people's health outcomes, while social factors make up the other 80%. So to improve the health of the population and genuinely make a difference there, healthcare cannot do it alone. We need to start earlier. We must work more closely with our social sector allies to genuinely make healthier SG happen. So this is what this year's CHI INNOVATE is all about. We're going to take you on a 3-part journey, starting off with part 1. Who needs to build bridges? Well, the answer is obvious, we hope, health and social care. But do healthcare and social care understand each other well enough to work together? This is something I always talk about. Do we build our empathic lens to see what others see? So in this first segment, Health Minister Ong will also join us to give away the National Healthcare Innovation and Productivity Medals and launch CHI's exciting new Health and Social Change Academy. So we'll hear more about that later. During part 2, we're going to look at who has built bridges before. This is where we hope we will inspire you with lessons and success stories told by people who've already fused health and social care with, we believe, unimaginable success and impact. And there's some lovely stories to hear from. Finally, part 3, let's build our bridge. We'll have 4 pairs of BFFs. Yeah, you see, I'm so cool. I speak in abbreviations. 4 pairs of BFFs from across the continents who are going to meet up to appreciate and solve each other's problems. So I think you're going to find that piece really interesting. It will certainly keep you interested all day long, and we hope also inspiring. We have something to learn from one another all the time. Okay, enough from my voice. It's time for our first centre stage speaker, Mr. Lee Po Wah. Po Wan's organisation, the Lien Foundation, are well known to have led collaborations between health and social care where there were none before. There were no rules, no signs or no bridges, and he was bravely crossing uncharted territory. So let's call upon the jaywalker himself, CEO of Lien Foundation, Mr. Lee Po Wa. Thank you.
Thank you, Tamsin, for that. Very good morning. Jaywalking is an American invention. It's a crime. It was linked to the rise of the car industry. With more cars flooding the roads, the number of deaths mounted. So to protect their profits, the car industry embarked on PR campaigns to blame the pedestrians, to lobby for laws to make roads more car-friendly. And they created the most offensive term to describe pedestrians, jaywalkers. I like to walk around the complex healthcare system, and I can relate to being a J, feeling like a J very often. What I'll do today will be share some bridging initiatives working on problems which the foundation cares deeply about. Palliative care is my first love at the foundation. I see it as a counter-discipline, a social innovation, which takes suffering seriously as a problem in itself to be solved. It's good medicine. It embodies the principles and practices of a good clinician. Palliative care is not just for the terminally ill in the last couple of months. It's not just for cancer patients. In fact, the profound truth is that the majority of the people who will benefit from palliative care are not dying. So I see there's tremendous potential or value to be unlocked if we go upstream. If we apply palliative care early in the disease trajectory based on needs to improve their quality of life and to reduce unnecessary suffering. So let me illustrate with an example involving NHG, since we are in a Novena campus. The breath is actually a bridge between the mind and the body. And breathing is the only function that we can do consciously and unconsciously. Breathlessness debilitates countless people with common diseases that are linked to the heart, the lung, the kidney, and cancer. So breathlessness is not just about feeling chuan, no? Because you went for a very strenuous exercise. The feeling is akin to suffocating, to drowning. So very often we take for granted, no? The ability to breathe, eat, sleep, pass motion, walk, and be pain-free. We only value them when we lose them. So imagine if you are breathless. You'll be reluctant to exercise. You'll be scared to go out of the house. Without rehab, it's a downward spiral. So there's high prevalence of social isolation, anxiety, and depression. There's fear of showering because water on your face is like, you feel like drowning. So you will feel constipated because you cannot exert. Eating is also difficult because you have to hold your breath to swallow. So upon diagnosis, it is actually 4 to 5 years of frequent emergency admission and hospitalizations. In fact, about 20% of those who has been discharged from hospital, they will come back within a month. So plenty of panic attacks, dying multiple deaths in a slow trajectory, impoverished quality of life, immense suffering and healthcare consumption. So what is the solution? We are building a support ecosystem of significant scale over the next 5 years. It is really a convergence of 4 medical specialties. The intent is to bridge the hospital with the community care sector, with the primary healthcare system. It will entail a big coalition, but we are starting off with Tan Tock Seng Hospital, AWA, St. Luke's Elder Care, and the Polyclinic system. And this is led by the very capable and humble Dr. Neo Han Yi. What does it entail? We really want to embed palliative care principles and practices across excellent symptoms management, better patient and caregiver support, consistent quality communication, ACP, etc. Focus will be on building capabilities in our day rehab centers so that they can offer cardiopulmonary services in the community. Right now, it's actually non-existent. We want to train the polyclinic system, the GPs, to better screen and diagnose, to change the referral pattern so that it's earlier. There will be a central system to ensure there's better patient and information flow. We want to explore technology for augmentation, breathlessness awareness, and eventual extension to the active aging center. It's a beautiful project. In fact, I drew a lot of strength from this whole thing last year. Right now, I'm talking to the Women's and Children Hospital, the National Neuroscience Institute, the nephro departments of various hospitals to encourage all. How can we integrate palliative care into specialty care? And all of us are dying for change. I do think that there's no healthier SG without palliative care. Personally, I'm more afraid of dementia compared to cancer because it inflicts a huge caregiving burden. I personally know of 3 lady caregivers who were suicidal. One of them was ready to push down mom and jump together. So caregivers who are fearful and reluctant to go home. Families fractured because of squabbles over caregiving responsibilities. So we started this post-diagnostic support pre-COVID. It's driven by Dementia Singapore and the memory clinics of 3 hospitals. Upon diagnosis at the hospital, there'll be a multidisciplinary team from Dementia Singapore to journey together with the families, help them navigate through all these complex issues for at least a year. The aim is to improve their skills, coping strategies, to keep the senior to stay at home for as long as possible, to reduce burnout and crisis situation which leads to institutionalization. In fact, I'm heartened that professionals across all these organizations, they are learning and working together. There's a seamless flow of information. In fact, the Dementia Singapore staff can actually call the geriatrician to troubleshoot any matters, anytime. AIC is actually extending it to another 5 hospitals. And if you think about the service concept, it is actually applicable for all chronic conditions upon diagnosis. So we are extending it to KK Hospital, specifically targeting caregivers of children with developmental needs. They have higher prevalence of mental health challenges with detrimental effect on the child. So the focus will be on early engagement, even starting at the polyclinic for those who are complicated cases. We want to do universal mental health screening, risk steering, and direct them to appropriate services. Eventually, to build a community mental health support ecosystem involving family service center, the preschools, even early intervention center. So this will entail KK building capabilities in the partners. There's going to be a stronger handshake and tightened workflows. And I also think there's no healthier SG without mental health. This one sounds like an action movie, but Mission Impossible brought specialist care into 25 preschools to support teachers and children who are 5 to 6 years old with mild special needs. It's a pioneering effort in 2009. This is the first time that hospital specialists actually work in the community. Government has since scaled this to more than 700 preschools, and they have renamed this DSLS program. And in the last decade, government investment in preschool has actually increased 5-fold. The ground is actually evolving so rapidly. I would say the sector is evolving so rapidly whereby the ground cannot keep up. So imagine, in fact, this is a classic example of program-rich systems poor. There are about 80 over programs, majority funded by the government. So imagine if you are PCF. PCF is Singapore's biggest preschool operator. They have 360 centers, 40,000 children. Think about the number of external parties they have to work together to provide the myriad services for their children and families. So we need a sequel. We have unfinished business. This time round, KK will be helping PCF to set up an in-house child development unit, multidisciplinary. We want them to be as self-sufficient as much as possible. For a start, they will support 16 preschools in the Northeast. Some of these are the mega preschools. Focus will be on universal in-classroom screening and intervention, starting from infant care. Because right now, if a child is diagnosed at 5 to 6 years old, there's a long queue. The runway may be too short to do meaningful intervention. So this will involve enhancing the training of all staff. The principle is very simple: how to push capabilities as close to the front line as possible to be responsive. There'll be stronger service integration with the hospital and the polyclinic system. My wish is that we can do a polyclinic bypass, so we can fast track, we can reduce drop-off rates. Another type of bridging involving the social services sector. During COVID, there was a clarion call to reimagine, to transform all industry, including the social services sector. But I do think that SSAs are stretched and they will be shouldering more responsibility with fundamental shifts in the healthcare system. In fact, I do think that some of the staff in SSA, they will cry just at the thought of starting something new, another new initiative, another half-baked initiative that came from elsewhere. Most SSA do not have sufficient capabilities and capacity of an innovation machine, the mindset and the skill sets. Actually, this makes them vulnerable. They are not able to seize opportunity or to respond effectively to escalating needs, you see. And in a time of flux, we need greater agility. Agility requires a stable platform upon which you build dynamic capabilities. This time around, we are taking a bet on Care Corner, specifically the CEO. Christian is down, no pressure, Christian. What we're going to do is to build an in-house team of talent, of design, tech, product management, organizational development expertise for them to support their various business units. We will also embed about 5 experienced change champions into their key service units to manage the tension and resistance that's come with change. Now, Peter Drucker once said that culture is strategy for breakfast, but I want to add that culture also is technology and transformation for lunch and dinner. So indeed, it is a challenge to change culture, to change operating system. But the foundation likes to play the long game. This is a 5-year kind of endeavor. We believe it is in our interest that we expand the capabilities and ecosystem of our partners to expand ours. Gin tonic is not an alcoholic drink. A lot of our SSAs are imbibing the whole thing. It is actually a high-tech strength training system that's safe and simple to use by seniors. So what we did was to bring in high-performance sports concepts, big data, and design to infuse it into senior exercise. We started in 2014 in a nursing home, but we had long since went upstream into the community to target seniors before they become too disabled. We have 29 sites operational, more than 4,200 active seniors, and we have capacity to grow more. Clearly, gin tonic has demonstrated the ability to increase strength, to reverse frailty. Sometimes I think about what is health. Health is actually mostly about function. It's not about the absence of diseases or death itself. So when it comes to gin tonic, we always start by asking seniors, what are your exercise goals? Actually, a lot of them, especially the aunties, or they want to lose weight, or they want to gain strength so that they can be more active grandparent, they can be able to travel and to pursue their passion. And indeed, it has been life-transforming for many sedentary seniors. You see seniors with a walker, they downgrade to a cane after a 12-week program. Those with a cane, they can chuck it away. Aunties able to go daily marketing without the need to sit down and rest, they can reduce their consumption of painkillers. There was a man who went into a depression because the wife passed away. And it was gin tonic and the community that pulled him out from that funk. Incontinence is also a major issue, especially among senior women. And some of these exercises focus on the core muscle. So with better continence comes better sleep, better mood, and better quality of life. I won't be surprised that the sex life of some of these seniors actually improves because it works on the same essential muscle. It's an unsavory thought, but I think it's a powerful marketing message to sign up all these dirty old men out there. I have not used it. Men are generally hopeless. 1/3 of the users of gin tonic is men. And of course, scientists has long proven, men is really the weaker sex. Women always always survive sickness, hardship, and trauma. There are about 200 senior centers island-wide. And if you just eyeball, maximum maybe 10%, 20% are men. Where are they? They are hanging out at the kopitiam, bantering with the beer ladies. For our overseas guest, kopitiam is coffee shop. You can think of it as Singapore equivalent of the English pub. So as a soon-to-be hopeless man, I have selfish reason to understand why, to understand the kind of problem. Are our current services not adequately designed with men in mind? So from hack care, we want to hack the kopitiam. how can the kopitiam be designed in such a way that it can also become a vital node in the entire care ecosystem? So right now we are chatting with uncles, even the beer lady to understand the psyche of the seniors. Seniors Go is a series of small but fun projects that we did this year. It's a little kind of experiment, but I see it as an antidote for ageism. Actually, many people out there, when they see senior, they think they are less capable, they are less worthy of attention. But the ugly truth about ageism is that this is actually a prejudice targeting your future self. If you treat a senior as young and able, they will likely to behave in that way. If you treat them as slow and infirm, they will conform to your expectation. And I do believe in the self-fulfilling prophecy of competency and achievement. So we placed 9 seniors. All the seniors actually came from Gym Tonic or partner AACs. We placed 9 seniors on a 12-week magic training program. So they pick up 5 nifty tricks, they can go back and impress their grandchildren or to hao lian to their friend itself. And they were assigned, each of them were assigned one signature trick for them to perform at the public magic show at the end of the training. And I must say it was a spectacular show. All thanks to Alexander Yuan, the magic trainer. Actually, among the 9, there is actually a cancer survivor. There's also a gentleman who's living with Parkinson's. Right now, Alexander Yuan and the foundation, we are talking to Tan Tock Seng and Khoo Teck Puat Hospital. Probably we want to work with about 30 staff, specifically from the rehab, psychology, and geriatrics department. How can we create a collection of magic tricks that can be embedded into their therapeutic and engagement toolboxes? So at the bottom, we put 15 seniors on an intensive 20-week music training program. At the end of it, there was a concert that surprised and enchanted all their family and friends. We literally drove 10 seniors up the walls. Yeah. We placed them on a 10-week wall climbing program. At the end of the day, all of them collected their certificate. And as a finale, we invited their family and friends and helped them go up the wall as well. At the bottom, we are exploring cyber games. So you see seniors playing Counter-Strike, Nintendo, and we want to make the Nintendo, we are still thinking through how to make it big and inject a bit more competitive element now there. So seniors' goal is analogous to life. You set challenging goals. You train, you work hard, you make mistakes. You have a teacher and you have fellow teammates to cheer you on. At the end of it, there's a stage for you to perform, for you to showcase your newfound achievement, to reflect on life lessons. So I think life is a story. It's not a scorecard or blood test to be optimized. Yeah. And all of us, a lot of those from the community will know there's a lot of lonely and bored seniors out there. They are dying to be delighted. They are dying to be wowed. So my experience at the foundation may not be relevant for many of you all. I just want to share 5 takeaways from our bridging initiatives. Look for curious and caring people on the other side of the wall. Create connection by offering them new perspective, new opportunities. I have 2 concrete suggestions. I would encourage the hospital to host visits for strategic SSAs, for deeper discussion. There's time and space for big conferences like this, involving key leaders, but I think we need more touch point. Secondly, I think a bigger pool of hospital staff needs to be rotated in the long-term care to foster understanding, to learn how to work together as a team. Actually, I have a lot of respect for nurses, therapists, and social workers in the community because they have to juggle many duties. But what we are seeing right now is that the community are receiving a lot more medically complex cases itself. And the sector, the community may not have sufficient skills to deal with it. So is there a role to do a systematic capability development program at scale involving the hospitals? A bridge like a relationship needs to be strong and flexible to accommodate each other's needs. There's always be tension of differences in the bridge, but the bridge cannot be too rigid, else it will collapse under pressure. Be cognizant about the power and resource difference when aligning population health objectives with financial incentives, especially when thinking through capitation funding model. A relationship which preaches partnership but practices paternalism is sure to fail. And don't undermine trust by being too transactional. So like any bridge, you need constant maintenance. As a grant maker, I have committed my share of sins. In fact, here in Singapore and overseas, in fact, I've done a lot of harm because of my stupidity, especially for projects overseas. So are we wasting resources on shallow solutions to complex problems, using somebody else's backyard and time? The path to healthcare innovation is littered with tech failures. Is there sufficient accountability? Is there sufficient sharing of lessons about tech failures as well? And the reality is that there's no magic wand, no silver bullet for deeply entrenched problems. It's not about taking courses, it's not about participating in the design workshops, it's not enough to generate novel ideas. The central challenge is always how to implement good solutions at scale and to pay for it. So when building mega bridges, please don't rush to go heaven. Take time to see through implementation, for iteration, for learning and improvement. Be patient and persistent to go through hell in order to get to heaven. There's a relationship between complexity, uncertainty, and risk. We human nature is always a tendency to make things more complicated. By doing so, we increase uncertainty. To reduce systems risk, we need to address the factors which make it more complex and uncertain. So any fool can make things more complicated. The challenge is how can we subtract, keep things simple, reduce bureaucracy, paperwork, power relationship, and unnecessary friction. The vision statement for DBS Bank is actually make banking joyful. Joyful. So what is our radical aspiration for the health and social care sector? And I'm biased. I always feel that jaywalkers are more observant and careful when they cross the traffic, because we all know it is the crazy drivers that cause all the accidents and casualties. And risk is all around us. It's like oxygen. It is natural. It is necessary for life and growth. So in this age of AI and automation, not taking sufficient risk is actually a big risk for all organizations. It's a recipe for mediocrity. And lastly, I would advocate, learn from the Condom King. Kun Mecha is one of my heroes. He's a revolutionary in the NGO sector with a courage of conviction. 20 years ago, I invited him to come to Singapore to inspire us to dare to be different. And he challenged me to organize a condom blowing competition. And let me end by saying that we all live in a rainbow of chaos and possibilities. Building bridges and walls is always in a constant state of flux. We build bridges in hope and burn them down in fear. So next time when we come to the bridge, please don't burn it. Please don't jump off. Let us cross the bridge with confidence and persistence to build a healthier SG. So thank you very much.
Thank you very much, Paul. It's amazing. Thank you.
Wonderful and inspiring talk there, and I think you've showed us that jaywalking, which used to be used to shame and blame people into changing their behavior, can be replaced with inspiring people and encouraging us and prodding us a bit. So thank you so much. And I'm also now delighted to welcome my co-host on stage, Professor Wong Hon Tim. Yay, he's
Hello.
Joining me here at last. Thank you.
Thank you. Good morning, everyone. I have to say, Poa, that was amazing. You told us how to break the rules and make our own rules as well. I think you will be forgiven for everything that you've done, and in fact, you're inspiring us for everything that you've done. Good morning, everyone. After that huge jaywalking, the Jaywalker's Guide to the Galaxy, it's time to move on to our next panel, and it's called High Healthcare Meets Social Care. So, in order to work well together, health and social must actually understand each other, like any partnership. But let's be honest here, I don't think we do understand each other well enough. So this session is meant to fix that, and we've called together 4 leading lights from the social sector representing their particular pillar within the social sector. And they will tell us about their highs and lows in their world, and also what keeps them going, what drives them, what makes them jaywalk. And it's a bit like a speed dating round because we're going to get through all 4 of them. So we needed a very experienced speed dater to facilitate this get to know you session. there's no one better than our great friend and a member of the Science Com as well, Dr. Douglas O'Loughlin. Doug, onto the stage, please.
By the way, thanks for really expanding what Healthier SG could be, for lots of different people. So thanks for expanding the way we think. And the other thing I thought he said, which we can start, is take a deep breath. Like take a conscious, I never realized that was the only thing that can be conscious and unconscious. So I think we should take a conscious deep breath, right, and really appreciate that. All right, so panelists, why don't you come on up, we're just going to jump in. If I took the time to explain and tell you all about these amazing people, it would take the whole hour. So I'm going to leave it over to them a little bit. So Nancy's at the end. Yeah, round of applause. Yeah, so thanks for being here, team. That's really wonderful. Like I said, it would take a long time to explain, so we're giving them over there. But before you start, maybe just do a quick thing. So Porsche is a founder of the Silver Ribbon. And just to check to see how many people know what you do. How many of you are familiar with Silver Ribbon? Does mental health? Show of hands? Okay, just a few, so you've got to share with a little more people what you do. Founded in 2004, way before mental health was on the landscape, so I think it'd be really helpful for us to hear from you what that journey has been like, what Han Tim just mentioned, okay? And then we'll just go through and then we'll come back to you. And how about Montfort Care? Raise your hand, so a little bit more. So Samuel is a legend also in the field, been doing this for 30 years, and we're really happy that you're also here with us, okay? Sang Chun is from Dignity Kitchen. How about show of hands, Dignity Kitchen? And please tell everyone, because everyone should know about what you do. How about Dignity Kitchen Hong Kong? Anybody? So they went to Hong Kong during COVID and did amazing things there. So we'll hear a little bit about that. And Nancy, okay, I don't think we need to ask how many people know MSF. But how many of you have come across Nancy in some way? She's very capable. She's everywhere across the sector, so many people know her. So yeah, so I think maybe one more round of applause for the four of them. So again, instead of just reading all that, I thought you can each share with us a little bit about why you do what you do and how you persevere after all these years. And yeah, what are your hopes for us as a country? Yeah.
Okay, I'll try to remember all
Thanks,
your
Boy.
questions. Hi, good morning, everyone. How are you doing? Great. Yeah, hope you are getting on well. And how many of you are feeling stressed out? Come on. Is this recorded? Yeah, why am I here? So I'll show you why, okay? I'll show you with my sample size over here. Okay. Yeah, so good morning, everyone. I would like you to show your hand if you have come across someone in your personal life who is coping with mental health issue. Personal life. Thank you. How many of you have come across someone who is coping with mental health issue at your workplace? Thank you so much. This is my answer to you.
Yeah.
Why am I here? It's because many people might be coping with mental health issue. Some might be seeking for treatment. Some might be struggling out there. So I really love this tagline. I really love this tagline, building bridges, health and social care. And in case someone asks, so why are you here? There's no mention of mental health. It mentions about health and social care, but no mental health. But not forgetting, World Health Organization has ever mentioned no health without mental health. That's the thing. And building bridges, and I heard the whole saying that you might not know each other. I think, I want to tap on this quickly, give credit to some people over here who is sitting among, y'all. And partnership is very important. We need to collaborate to serve the community. And it's not as easy as they won't just pop up at Institute of Mental Health for help. Many people have to come together to work hard. I remember some of us will spend our Christmas Eve at the E-room of IMH. So many people are struggling. We have to work very closely together, but we have to believe in collaboration. So the thing is, I must give credit to someone. Where's Hong Chun? There's Hong Chun?
Yeah.
Yeah. I must give credit to him. He was the former CEO of IMH. And every time, wherever we come across any residents at the community saying that, Porsche, I'm losing faith in the mental health system, I'm not having a good experience, and I don't know what to do. And every time I email Hong Chun, and he will never fail. He won't respond the next day, but he will respond immediately, as long as he's available. This is him. So we must believe in collaboration. So when the host said, you might not know some of them, I know some of you here, and this morning we explore partnership. And where's Bing Lit? Bing Lit? I will with Bing Lit. And she was formerly heading OTD in Institute of Mental Health. And back then, I was working in another department in IMH. So even inter-department, we must work closely together and ensure communication. What is our aim? To serve the community, to serve the patient, to address the gaps. So thank you, Binglit. And even right now, she's with SIT. What did we discuss this morning? Collaboration, partnership in providing peer support for the students. And where's Adi? Where's Adi from Tai Hua Guan? Yeah? Adi? Yes. See, Adi? Adi was formerly from Health Promotion Board, and we worked on a number of mental health projects. And right now, he's leading a team in Tai Hua Guan. And what do we discuss, Adi? Collaboration on mental well-being of the staff, of the patients in Tai Hua Guan. That's my answer to you about collaboration. Thank you.
Thanks, Porsche. So I saw a lot of heads nodding about no health without mental health. That's a good reminder. The other thing that you did when you asked people to raise your hand if there's any mental health issues in your family, almost everyone raised your hand. And I'm not sure about you, but I think most people go out, put a brave face on like everything's okay, and often it's not. So let's also keep in mind that what we see looks okay, it may not be. So how do we be really extra kind to people? How do we connect with people in a way that creates those kind of conversations? And it also reminds me that one person who was supposed to be on the panel, Josie Biao, she's the founder of the Sing Health Patient Advocacy Network. She's award-winning caregiver, whatever that means. She's an awesome caregiver. And her daughter had a lot of heart issues, and she ended up in the hospital yesterday. Otherwise, she would be here. She would love to be here. Again, you meet her. She's this very joyful being. But the burden, many of you know that burden of caregiving. So I think that's just really a reminder to take care, build bridges, small ones, big ones, really big ones, whatever those are, but just be mindful of what's going on with other people, okay? So Samuel, how about you? How's your journey?
Good morning. I'm going to take this time to sell Goyo because it is very rare opportunity for us to be given such opportunity to come and share. And my feeling is quite complex because I have been a social worker for 30 over years. And while today we talk a lot about collaboration, we need to build bridges and all this, I remember this was not such a case 30 years ago when I first started out as a social worker. At that point in time, for those of you who are, about my age, or older or this, I don't know whether you remember or not. The healthcare and social service is like 井水不犯河水, different longkang one, never meet each other. And then as a young social worker, even at the FSC's level, I think that time I was with Care Corner and all this, I had a lot of time, every day we curse and swear, of the hospital, not able to get the patient information, and ding ding dong dong and all this. That was the time. And then, in the social service sector, we always say, the hospital people, the Tua Lokun and the MISI, all this look down on us because we don't have chim terminology. Like in the medical setting, I remember a few cases when we sit down and talk about case management, and the medical profession, you all know don't understand all the Latin words, like all these are catch no ball. and all this, so that was in the past, that, there was a serious breach and all this. And I think, one good thing about this Healthier SG that is coming forward, at least today, so it's a bit surreal for me. Today, like my presence here, actually, I would think that in my career lifetime, I would not have seen such a thing happening, So I'm very happy that, maybe my presence itself, at this conference, speak, of the mindset change of the healthcare people. So congratulations.
Yeah.
Thank you for welcoming me. And a little bit about Montfort Care. I started, as I'm the founder, I started it in the year 2000 because I was jobless. And then hospital don't want me. So then we started off with a family service center. So most of you, a lot of people know Marine Parade FSC. That's where we first started. And then over the last 20 over years, we expanded. So now we have 3 family service centers. We also run a child protection specialist center that's dealing with child abuse. So that one, we also work quite a lot with the hospitals. And then we also run a 24 hours national hotline against anti-violence. So that is for the social service side. So we grow and then we... the other part is, since the year 2000 or 2001, actually back then, nobody is talking about aging population. So in Marine Parade, I started what we call today AAC. I remember that time, my thinking is very simple, that I just feel that as a professional, we are very remedial. Whether you are a social worker or whether you are doctors or this, we are always focusing on the disease. I mean, for you, disease and all this. For us, is problem and problem. So I thought after many years, we should actually go a bit upstream. So at that point in time, I started this, social activity center in Marine Parade. I remember that time we just very simple. We have a few massage chairs, and then we just get the stay-alone seniors to come down. And then later on, we expand it to, some of you know, Good Life Makan. That is where one of our innovation programs that I feel that whenever we talk, actually a lot is about mindset and labeling. A lot of time when we talk about all these needy people, for example, stay-alone senior, we always think that they are very needy, they are very helpless, they need our help. So we dish out a lot of transactional help. At the end of the day, the end result is that we are disempowering them, actually, with all your assistance and help. So I say, why not we create a community program for them? So we started this community kitchen, thinking that, wow, we get all the stay-alone seniors come down, they are taugeh lah, correct? Some of them cook, and then we fail lah, because a lot of them cannot cook. They think they can cook. I remember one night I invited ESM Go for a private dinner, because Marine Parade and then our elderly stay-alone say, wow, it's ESM Go. So they make a very nice hotel qiang, small one, but Buddha jump over the wall. And then at the end, I tasted it, they forgot to put salt. No, quite tasteless, but ESM very good. He just finished everything. No choice, right? So anyway, so I thought, instead of just transactional help for them, maybe we should actually think of creating community and building self-help program. So later on, if I have opportunity, I'll share more when we are Healthier SG, how can we move towards that? Okay, thank you.
Okay. Thanks, Samuel. So, before we move into another amazing person, so it appears you've seen a few things a little bit ahead of your time, right? The early days of FSCs, building bridges, the active aging, the whole thing, even working with child abuse and everything. So what's your hope for what that next stage might look like? You have this whole platform here.
For Healthier SG?
Yeah.
Okay, to be very honest and frank, I really hope that we don't make our seniors, elderly in the community become a patient in the community. You know, with all this, measuring heart pressure, okay, all these are very important, but I think my hope is that, bring them happiness. That's why we call it a good life. And it's a very simple thing, come them together, at their, they have contributed much to the nation building. So now can we bring forth happiness?
So you must have aligned with Powa's message, I guess?
Yeah. And for example, I mean, a few years ago, I already thinking, that at the community level, we need to also revamp. Because a lot of our models are quite yesteryears. Bingo, line dance, nothing wrong with that. I also play, But the hard truth is, I ask myself, I'm 56 this year. I qualified to be a senior. I'm not the super rich, So will I walk into any of the SAC, the exit test? And to be very honest, I will not. Not that I'm uncle, not that I will go the kopitiam. So a few years ago, I decided to rethink, how can we come up with this, what today I call future-ready AAC. So later on, I may want to share. So I really hope that our aim goal is to make every seniors in the community healthy and happy. Thank you.
Okay, and as I introduce Seng Chun, just remember there are questions if you want to enter any questions. Another pioneer, done amazing things for the communities with people with special needs and really raising the capability of the whole country and then spreading it. So Seng Chun, thanks for being here.
Good morning, everybody. My name is Seng Chun. I'm from Project Dignity. Most of you will know me by either Dignity Mama, which is in 5 hospitals, or Dignity Kitchen. We also have a kitchenette. We also have Dignity AI, which is running around hospital right at the moment. So, first of all, I'm very honored to be here because I'm neither a social worker nor a healthcare person. I'm actually an engineer by training. And I think I'm the ideal bridge between health and social. Because you see, if you study Maslow hierarchy of needs, right? Engineers are very logical. The bottom one is subsistent. Whatever you may do, healthcare may take care of them, but it's what happened next. With what happened next, all these nice fancy things that you do, taking care of the health, it doesn't make sense. And that is employment and job. So Project Dignity was started in 2006, and the idea was to create jobs. So how it started very small. By the way, some of you are my customers at Balestier, remember? The one store stopped, it started from there. One store, it went on to become 102 places now in Singapore and in Hong Kong, employing over 180 people. 80% of people with disability. If you go to see my place, you see physical, mental, social, intellectual. Physical as in loss of limb, mental as in schizophrenic, bipolar, social as in abuse cases, and intellectual is IQ 70 below. So I pick them together and I train them. It's a 22-day program. The ideal end of it is to give them a job. So you skill them first. Whatever disability you have, whatever health problem you have to skill them. And cooking is a need. You need to eat, right? And you need to do that, you need to skill them. After I give them employment, meaning that you create job for them. So like now my biggest customer, now people require is the Mandai Zoo. They require a lot of people. So we train and place them. My placement is 100% got job for a very simple reason. Singapore quota system. You need Singaporean, right? That's why I told you I'm an engineer. I'm not a social worker. You got to think like an engineer. You need my IC number. If I cannot get you job, I create jobs. So the first most famous among them is Khoo Teck Puat, NUH, in Tian Phong, Sengkang, Changi. There's a Dignity Mama. Mama shop was not created for the kid. What people don't understand, those are kids with mid to low functional, and their job opportunity is practically zero. So what do? You put a mother together. So mother and child, looking after a child. The whole focus of Mama is not about the child. It's about the mother, the woman, and the caregiver. People don't understand. Mother-in-law, father-in-law can kick you out. Husband can run away, but the mother cannot go. And that is why it's called Dignity Mama, by putting them together. There are 36 people in 5 hospitals. There are 24 of them now in Hong Kong. Queen Elizabeth Hospital, Chinese University Hospital. are created for mother who give birth to disabled child. Then I started the next one, Dignity Kitchenette. Kitchenette is a very unique operation, started 2 years ago for mental patient. You go to what the mental patient do, the hospital, you take them and then they rehab them. After rehab, you find them job. So I realized, why don't you take them when they're inside, like a prison halfway house? So we take them in and we put them inside. And we get them job. It's a kitchen cake shop. We got Dignity. My favorite is Dignity Avatar. It's a robot running around. Originally it was at Ng Tien Fong Hospital, but they say they want disabled nurse. I don't have disabled nurse. I got retired nurse to monitor. So still on the I'm trying to hope to go to. If you guys, even Tan Tok Seng, I've done the demonstration 4 times. It's still no go, right? So that's why I'm the last person you want to invite for your talk today. Anyway, the idea is very simple. After scaling them, I'm giving 1 minute, 54 seconds now. Scale them, give them job, integrate back to society, and finally getting society to accept them. So we corporate events all the time. But one of the most important things we do is we have this food giving out every afternoon at 4 o'clock. Go down and see. We get the people who have healthcare, people with problems, to serve the poor people with boxes. Those are the people who clean hawker center. You guys always talk about it. Why don't, I can't give you money, but I promise you dinner every night. Over 70, 80, 130 in Hong Kong. So these are the things we do to give them the motive. These people are sick, they recover. But you also get their heart to do something, you know, by giving food to people, packing for the disabled. So it's been around for 13 years now. Award winning. We won the world famous. We just won the World 50 Best Restaurant Award, Champion of Change. You can't get this. This is for people. This is not like Michelin star. 3,000 chefs in the world nominate one person, and that I got it last year with 20,000 pounds and the airline ticket to fly to London. So 5 more seconds. So basically, what I'm trying to explain to you is, first of all, and we also skill them, get them job, integrate back to society, and get society to accept them. Currently, we have 180 people in 2 countries, and we are expanding now. We are going to build Dignity Kitchen number 2 in Singapore somewhere, because the problem I have is very unique. They don't want to go. Even they train them, but they don't want to leave. So all this, so I got to find a second one. I'm opening another mama store and just keep creating jobs. Because they need jobs. That's the bridge between the two of them, social and health. Thank you.
Well, I would say all of you, but the way you've articulated it is a lot more than just social and health, you know, economic and spiritual. There's a lot of that to that. Samuel, you were going to add something?
No, because he keeps saying that he's engineer, not social work. Then I remember in US, they did a research and they found out about the mid-career change. And people convert to becoming, you know, social service professional. They have found out that the most successful one are the engineers. So, welcome.
Yeah. And we have some evidence right here, yes? Great, okay. And Nancy, how are you? Nancy and I worked together for many years at MSF. You're all over the place, supporting all kinds of groups. And yeah, how do you want to share your perspective today from the social sector?
All right. Thanks, Douglas. Good morning, everyone. It's really a hard act to follow after my fellow panelists, but I shall try. Actually, I prepared a script yesterday because I was a little bit stressed about today, but I think I will leave it at my side and refer to it if I need. Well, my name is Nancy. I'm a social worker by training, like Samuel, and actually Paul is also a social worker. I returned to Singapore in 2000, and I joined the ministry. So it's been quite a number of years. So over my career, I worked really closely more with children, youth, and families. So and I enjoyed all my years as a social worker, by the way. I know a lot of people feel that social work is so difficult and all that, which I agree. I actually was a clinical practitioner before I became a policy developer and implementer. So I know the experience of being on the front line and all that. I really enjoyed my career as a social worker. So when the organizers approached me to be in this panel, I said to them, actually, I have no experience in the space of social health care. So my work is really with just children, youth, and family. If you talk to me about youth offenders, I can go into 1 hour conversation about youth offenders. But really, the social health care is an area that I have not sat in, but I have been involved in conversations about them with my students or with fellow colleagues, practitioners. So what happened was in 2017, a couple of like-minded colleagues and I can name their names, Dr. Vincent Ng and An Bilian. Three of us actually were very concerned about the leadership of the social service sector and the leadership of the health sector in terms of the social work profession. So we felt that it is so important that these two groups of social leaderships, social work leaders, come together and have cross-training together, and also to formulate the leadership qualities in these two groups of professions, although they belong to social work profession, but they're working in two different spaces. So it was because of my area in this work that the organizer felt that I should be in this panel to share our experience in that program. The program is called the Spark Series. So in 2017, we brought together social worker leaders of the health and the social sector to come together. Now, the intent is not to train skills and knowledge, because really there are many other programs to do that. Our intent was really to help these two groups of leaders to come together, to kind of transform, to reflect and think about their value system, and what are some of the journeys that they have to take to become leaders of the sphere. To put it bluntly, in 2017, I was very worried because there were a lot of views that was being expressed. But we know that there's a whole group of people who are in the middle space who do not want to participate in a conversation. So our conversations with the leaders then, our participants then, was to say, hello, you are leaders of the social service sector or in the social work profession. You have a role and a responsibility to speak up. So social health, this social health space is definitely, there are a lot of, I don't think we have solved the problem. I think we are not even near there to solve the problem. So it's a journey that we have to take. So this, when we started in 2017, we have finished 4 series, and then COVID happened. So we kind of like, I got pancit, you know what's pancit? I got tired and I said, okay, better stop. The good news is that recently, my volunteers who have been working with me said that they are willing to bring this back again. So for those of you, who are thinking about maybe some of your younger leaders will benefit from a platform like that where they come together as leaders. By the way, so what is Spark? Spark, basically, we bring them together to listen to leaders of other disciplines, not related to social service. So they have heard the likes of Ms. Lim Soo Hoon, Dr. Cheong Kun Hien, there was a very famous Xie Sun Yen, who is, I don't know whether you all know him, but he was one of the first Asian to be McKinsey. So over the 4 series, we put speakers in front of them to talk about their struggles as leaders and their values, struggles that they had. So Spark is actually a journey that all of them went through it's about 9 months, by the way, a journey where they do a reflection and really question their values. I tell you, social workers, psychologists, counselors, they are very strong in their value system. But the minute you take them out of the practitioner role and put them as leaders, all of them struggle, including myself. I also had to struggle. So I have only 5 seconds. Okay. So what would I like to see for Singapore, really, or for the sector, is that as a social worker, I want to work myself out of a job. I wish my counterparts in overseas had said to me, Nancy, in our country, 没政府不死, meaning no government, no die. We won't die. I wish that our community will build up to an extent, including the SSAs, where we do not need the government to come in so much into our citizens' lives. So that is my vision. Thank you.
Wow, thanks, Nancy. By the way, I know you're not scheduled to be a panelist, but you know what the debate is? We have a debate later, and it's about whether it takes government to lead healthier SD or whether people in the community need to take their own responsibility to be healthy. So I think we should get you on that panel, Nancy. You know, I'm not sure about you, but from the first time that we've all met, or some that know each other, it's not just what they do, right, but it's who they are. I think who we are and how we show up also builds bridges, right? So ideas are one thing, but when the people advocating them have such deep passion and credibility makes a big difference. So kudos to the four of you for your tireless work. And you all look so energized, even if you've been doing this for work, and it's hard. It must be hard sometimes. Sang Chun, does it ever feel hard for you?
If somebody asks me whether I want to give up, I want to give up every day. If you tell me, you see, people always want to be a social entrepreneur. Now it's need to be a social entrepreneur because over 180 families depend on us. Every year I chunk out hundreds of people who are trained and placed. So is it hard? Don't do this, please.
All right, well, it's good to warn people, yeah. Okay, ahead.
But I think sometimes relating to your earlier part, anyway, Healthiest SG is initiated and pushed down by the government.
Right.
So that one no need to debate, right? But sometimes I find that, that we need to have some space, especially in the community, because a lot of things, I find, this social and health, one of the things I've been thinking about it, because I've been more with the social service sector, I think the DNA are very different. Actually, at the end of the day, it's about the same because social service, we're also dealing with a lot of their mental health. Relationship is also part of mental health. So the outcome is the same, but somehow in the development of these two professional tracks in Singapore, it altered the DNA a lot. That's my view. And the healthcare sector has been very institutionalized, very structured, which is the strength. So there's a lot of organization capability. And then the social service sector, on the other hand, is more indigenous. And it has to be. I always say, can you imagine we're dealing with family? Family, if you walk in the family, is very luan one, right? If you walk into a house and all this, it's almost like IKEA, showroom, that kind of showroom, that's not family. The Chinese saying that, family is 一地鸡毛, correct? Sure have a lot of feathers and all this or that. They will fight each other and all that. That's family. So community is the same. But if you want to actually institutionalize and structure it too much, at the end of it, it's lost that very essence. So how do we actually want to merge the two? I think, to me, the first place is that you must start to actually understand each other first. Not to rush into, today because the government say there's no choice, like AIC asks us, I'm going to work with this, going to work with St. Luke, going to work with NTUC, going to work wherever. Okay, but it's just that, I remember, when I first started the center in Yishun, I'm forever very grateful to, I think she's here, Sweet Fan, Dr. Sweet Fan.
Yeah, she's here.
Yeah. And then at that time, she knew me, nobody else, and then she said, hey, why not you come and follow me for her walkabout. So I tagged around. Remember one Saturday morning, the whole morning, I follow her, become her assistant, go and see patients. I understand the hospital works and all this. And today, because of that, our Yishun Center actually worked very closely with Khoo Teck Puat, especially the memory clinic in terms of dementia. And recently, we also work with them on the alcoholic, because we realized that the alcoholic, because they got intoxicated and high and all this, end up they all go A&E and have another party there. So we are able to actually, but it all started with relationships. I find it's because I trust and I respect, Sweat Fund a lot. Therefore, I say, okay, I can work with Khoo Teck Puat. Then we started. So I think the starting point is to understand each other.
And another person with great credibility. And I think what you're saying is we should be capable, we should go out there, we should be open to people visiting us, yeah?
And the key thing is she doesn't look down on me, being a social worker. Hey, honestly, that one very important.
Okay, he says that with a smile, but you all get the message, yeah?
Can I
St.
just,
Chun and
can I
Nancy,
just
want to
add
comment
what
on
I
that?
just said earlier? Basically, I wrote somewhere that says success is a satisfying state of the mind. Failure is when you stop trying. So if you ask me, when I look at my mama's store, the mother and child working together, it reached a stage that the mother don't need to come to work. And the most satisfying thing is one day I saw them make up, go for afternoon tea. together. So basically, what I do is very hard work, and it's very challenging, both for myself, my family, physically, mentally. But the very essence that I see this thing going out, getting job, having a living, and that is what is caused very satisfying. Have I failed? I haven't stopped trying. So I think I haven't reached a stage. I think maybe Dignity Kitchen, Project Dignity, will go on for many years to come. Right.
So I just want to add on to what Samuel earlier talked about. Government should not be too structured, or rather, if it's too structured, the community space is a little bit limited. It just reminded me of something. I see, just now, as in the introduction, I'm almost like everywhere. And recently, a few months ago, a feedback was given to me, and my response to the person who gave me the feedback was that I'm in no position now to influence those kind of decision making. But then I realized, hey, this is a good opportunity for me to give the feedback to ministry or to the both sector kind of people. So the feedback given to me was this, Nancy, MSF, when they roll out programs, right, they actually have a process. They go down, engage the vendor, the SSAs, and we talk, and it takes quite a while, and then we talk about developing the practice, the capability, and all that. Then, when it came to the health side rolling out, there are recently a lot of rollouts of the active aging centers, the mental health components. Her feedback to me, and she was a trained social worker, by the way, she said when it comes to the health side, the rollout is really quite different. And she felt quite neglected as a professional, that she felt that the professional capability building process was not done in a way that MSF does it. So she said, can you help us to advocate to MOH to really try to follow the process that how MSF roll out programs. I'm not saying that MSF is, just because I'm MSF, I'm not saying that MSF do it perfectly. What I think, to respond to what Samuel said earlier, is that also sometimes in our jest or we know that we are doing this for national citizens' best interest, and there's sometimes timeline, you need to do it quickly. But I think on the ground, community professionals or practitioners sometimes are quite chuan because of the government. So I just want to remind us all who are in the government sector or quasi-government or people who are rolling out programs. I just want to give this feedback on behalf of this professional on the ground. I also need to remind myself now, because I'm in the space now where I actually roll out programs as well for divorce and marriage support. A little bit of Koyo. I actually now involved in divorce, marriage, and family support programming in the sector. Yeah, so I just want to add that on. Thank you.
Before you go, can I just share, because there's a comment, we're not going to have time to get to all the questions, but there's something about being paternalistic, and you've mentioned it a couple of times. So I think it's just a reminder for all of us to really pay attention to the power distance and the relationships that we connect. So I work in civil service college, so we tell, the idea is, as a ministry, you don't beckon people to come, right? Prof. Chu, Group CEO of NHG, he always tells people, do not invite people to your hospital. Go meet them on neutral ground. Go for a coffee shop. So really pay attention to the power distance. And if you have something from the other side, a request, there's comment about we would appreciate the social sector doing more evidence-based care. Let's talk about it. How do we do that? Maybe you have expertise they don't have. So I think it's really important to build those kind of bridges. Continue to build them. Push, yes?
Yeah. I think communication is very important when it comes to collaboration or building bridges. And you need a lot of support. And earlier on, I shared about the need to believe on the need to collaborate. This is very important. We need to receive the right support. And actually, there's a very significant person who is seated there, and I spotted her, and she'll be smiling away. And there's Prof. Swapna. Yeah. That's my former boss. Yeah. The thing is, I was still working in IMH, and I spoke to Prof. Chung and Prof. Swapna. I said, Prof, I thought there's a need to fight stigma. No point having world-class treatment, but due to mental health stigma, many people are hesitant to come forward. No point. No point having the best psychiatrists, the best system, but many people are hesitant.
Okay. Okay, so that light means we're done, I think. But there's one question that got voted up. Can you all do a lightning round, one or two sentences? Because this is a big one, and I think it's relevant for all of us. It's a perfect ending question. So there's a little bit of this not my problem, like in all the issues that you deal with, and people are really busy. Poa mentioned how everyone is so stretched, right? So people are really stretched. They're trying to get more head count, and yet we're saying, build some more bridges. So it's not my problem thing. Can you give a one-sentence advice for all of us, reminder for all of us, about how to be more inclusive when you're already exhausted and stretched, and you have your own KPIs and things like that? I know that's a tough one to finish, but anybody want to give it a go? Just one or two sentences, because obviously the lights are telling us we're out of time. Whoever wants to go, yeah.
Actually, while you may not realize it, I'm actually an introvert. So to build bridges for me is really, really tough, to be honest. Because to build bridges, you have to really go out and really socialize and talk to people and build that relationship. The only, I have to say, I just have to get out of my comfort zone to do it. So that's my advice.
So do it for all of us. Okay, thanks.
My one-liner is that for everyone we help, it's not the person we help, it's the family we help. So if you can solve the autistic boy problem, you solve the whole family problem. It's not off. Second thing is look at their ability, not disability. And you'll be surprised. Come to Technique Kitchen for lunch, you can see how they actually work itself. And that will be more impressive. Okay, thank you.
Okay, got it. Sonia?
Actually, I don't quite know how to conclude because I thought we just finished our ice breaking and then we are supposed to go for more in-depth discussion. The lights on already. But anyway, I thought, hopefully there will be future more opportunity. But I thought, that come and make friends with social service, so-called professionals, because we are all very kind-hearted one, we are all full of empathy one. And we are for a bit South Korea or North Korea, early on I said, we are actually trying to build a future-ready SSA that will cater to the new generation. So I built a few of our center. Per mine, we built maker studios to address Poha's, part of the concern that uncles are not coming. So we actually built quite an interesting, carpentry work. So come and visit us, and we can have a coffee, and then we can talk about our mental health together. Okay, thank you.
And speaking of mental health, thanks so much. Speaking of mental health,
Simple one. I mean, take care of your own mental well-being while you're serving others. Yeah, equally important. Thank you so much.
can we have one more round of applause for these four amazing people, the work they do that continues to expand. Thank you so much for the four of you. All right. I think there's a picture? Is that it? Didn't happen unless there's a picture.
Okay, while the esteemed panel is having their photo taken, thank you so much. That was fascinating. We know there were far more questions submitted than they possibly could answer. Fear not, we will grill the panelists later and we will share their answers via CHI's social media channels. You see that little win-win there? We draw you into our social media platforms by sharing the answers there. Thank you so much, Doug and panel. That was really a wonderful and heart-lifting session. Thank you so much. They will be around for tea break. Right. You will also see some of these panelists later. They'll be joining us here where they meet their BFFs. Here I'm trying to be trendy and cool and young again. What we really mean by that is bridging friends forever. So you can find out more about that at the end of the day. Oh, I've got a load of instructions for you now. Anyone that's ever been to one of my workshops knows that there's no passengers. You never get to sit and listen or sit on your phone. Brilliantly, same here. You are all going to be involved in something super exciting in a minute. Don't groan. Okay, this is the big ask, the big favor. After the break, we have Minister Ong joining us, and he's going to officially launch CHI's new academy, their Health and Social Change Academy. Yeah, you get to be part of the fun for this. This is super cool, right? Yes? Oh, yeah, I can see. Some people have already guessed it, right? The star performers in the room, they're making the actions in advance. Okay. I also want to remind you that I'm from something called the School of X, and Some guy who owns Twitter recently was so inspired by that, right? So we're gonna follow that trend in a minute. So I would like you all to look in your bags, please. There are no one must let the side down here because we need everyone, which is symbolic of what we're trying to achieve. Everyone needs to play their part. So inside your bag, that's it. You know what we're looking for. Glow sticks. You should have 2 different colored glow sticks. Oh, look at my wonderful assistant here. I am going to ask you all to snap your glow sticks, please. Yeah? They're gonna last, apparently they last 12 hours, is that right? Oh, it's already, I feel like I'm in a disco. I wanted to wear a Barbie pink disco outfit today, but my 14-year-old son wouldn't allow me to leave the house like that. Okay, this is looking good. Yep, bring your glow sticks to life. Give them a good old shake, snap them and shake them. Some of you are ready for this. You're the ones that had the pint of coffee for breakfast, right? That's right. So I'm going to tell you, these are the instructions I'm going to give you now that you're warming yourselves up and your glow sticks are glowing. Some of your glow sticks not yet glowing, keep going. Give them a good old snap. That will release the magic chemicals to make them glow. Some of you are still working out how to open the packets. Okay, we have time. After tea break, your glow sticks must be alive. Some of you are already worn out from waving them. I see you. Okay. Are you ready for your instructions? Yeah, you need to pay full attention here. This is training time. You're having too much fun. We are going to have a countdown later with Minister. We're going to do a full-on 5 down to 0 countdown. So we're going to do a quick practice now. As we count down, 5, 4, 3, 2, 1, you're going to do what you're doing now. You're going to wave your glow sticks wildly. Let's practice. Wild waving of glow. Woo! Oh, it looks awesome. So cool. I've got the best view in the house here. Okay. Now, when it comes to 0, and at that point, Minister will bring the 2 halves of the bridge together, you are going to form an X with your glow sticks. Wow, I feel like this is my brand living out in front of me here. We definitely need a photo of this. Okay, so let's have a quick practice, okay? I'm going to do the countdown. Remember, 5, 4, 3, 2, 1, you wave. Here we go. 5, 4, 3, 2, 1, and 0. Whoa, you guys look awesome. Well done. Okay. Now pretend you're not excited. We'll save the excitement for later. I will need you to hold your X in the air. So, well, not right now, but, later. So I'll let you rest now. You can have a rest. Well done. Don't lose your glow sticks during your break, yeah? Keep them in your bag, ready to go. I will instruct you again later. When we take photos, and we've got all the very important people up here, hold your X in the air until I ask you to put your sticks down because we're going to get a very beautiful photo, okay? Everyone happy to go ahead? Looking forward to it? Okay, I think I have more rules and instructions for you. Okay. Tea break. Tea break is kindly sponsored by National Health Innovation Centre. Thank you again. Can I please invite the VIPs, our speakers, those of you who are here, VIPs and speakers, to please head down to level 2 for your break. For everyone else to save your legs, we have refreshments here on level 5. So head out to level 5. You can grab your refreshments there. And we will see you back here. Start making your way back to your seats by 10:25, okay, for the fun and excitement. Thank you so much. See you soon.